From coast to coast and beyond, people in North America are doing fascinating things to make their cities, towns, and regions more interesting, more successful, and better places to live. Join me, Terry Bradshaw, as I explore all that's new and exciting about the USA and Canada and what people are doing in order to make a difference. It's an easy way to see what's happening across your own country. Welcome to Today in America. Approximately half of all chronic diseases are linked to preventable problems, including smoking, obesity, and physical inactivity. Games can be effective in motivating healthy or positive behaviors because they provide the user with continuous engagement.
Games are the most potent tool we have for motivating people to try new things, to get them to act together, to change their behavior over time. So by harnessing this fundamental aspect of human behavior, we can really help motivate people to make really significant changes, to move away from disease and towards health.
Based in Vancouver, Ayogo is an award-winning company that creates serious games designed to help people become better.
One of the great things about digital games is that they can actually support players to change their behaviors. And the way that they do this is through a series of reward structures and through the game's rules systems. This is through a kind of gamification model that we've had in education for a very long time.
A growing body of research shows that digital games can positively alter players' attitudes and behaviors.
Games are very good at nudging people, nudging them in small ways, to try out new things, to interact with their health in new ways. Small nudges that add up to large changes over time and new healthy behaviors.
Ayogo created this software platform and social mobile health game in partnership with Santa Fe Aventis. Its purpose? To help families of young children with diabetes stay on top of their testing and logging schedules.
So by designing a gameplay environment where the player is rewarded with a positive, joyful experience when they do the right thing, we can be there in the right moment to reinforce the correct behavior, help a child habituate some new behavior that's going to be important to them their whole life.
Kids aren't the only ones benefiting.
Also, the parent and caregiver benefit. They get a real-time stream of information about the child's blood sugar, their reporting schedule, and so on. They can set the parameters around that schedule so the child knows when and how they're supposed to report. But beyond the mechanics of reporting and this important information that the game provides, it also gives the parent an opportunity to reach into the child's gameplay environment, to give them contextual rewards that are meaningful in the context of the management of their diabetes, but also responsive to what's going on in the life of that family. We think that's very important to help a whole family manage this chronic disease.
Games can also integrate biometric sensors into the gameplay. Ayogo created I Heart Jellyfish in partnership with the University of Southern California's Body Computing Center.
What we've done is we've connected the player's heart rate to the game environment so that a clinician can set the parameters that the player needs to meet. For example, a child that's struggling with anxiety will be more successful in the game if they keep their heart rate low and steady. What we're trying to do is help children and adults understand the relationship between their heart rate and how they feel so that they can control their heart rate in meaningful situations.
SisterMatch is a social matchmaking game that helps women with diabetes find and connect with one another in a unique and innovative way.
We built the Diabetes Sisters SisterMatch website to help women with diabetes, many of whom are in their 40s and 50s, to meet each other, to build bonds over the internet. What we wanted to do is to let them use games and quizzes as sort of icebreakers to build a relationship, and within that relationship they can support each other through their common health challenges and also encourage each other to stick to things like diet plans, exercise plans, and also to take medicine reliably.
This is all about creating innovative and imaginative ways to engage people and to empower them to become healthier.